Let's talk about the management of status epilepticus. Status epilepticus is a continuous seizure activity that does not resolve spontaneously, or seizure occurring multiple times, or recurrent seizure without any recovery of consciousness in between the seizure episodes. That is status epilepticus. By book, its status is seizure activity for more than 15 minutes, but clinically, whenever there is seizure activity going on for more than 5 minutes, we consider it to be a status. So whenever we have a patient of suspected status, the first steps are very simple. We follow the resuscitation protocol A, B, C, and I have added the D. What is A? First of all, ensure that airway is patent and try to keep the position in the left lateral side. Ensure the airway is patent, very important. Try to give oxygen to prevent cerebral hypoxia, which commonly occurs in patients with seizure. Then maintain circulation. How? First, check pulse, check blood pressure, and check glucose. It's an additional step. After checking the pulse and blood pressure, try to get an IV access, IV cannula. And during the IV access, take a blood, that is D for draw. Draw blood to send samples for some investigations. And the common investigations that we need to do are, first of all, glucose, because hypoglycemia is a common cause of seizure. Electrolytes, electrolyte imbalance such as hyponatremia, hypercalcemia, hypomagnesemia may lead to seizure. So do electrolytes. Do separately, do calcium, because the common electrolyte panel does not include calcium and magnesium. So write them down and separately. Do the renal function test, especially the urea and creatinine, because uremic encephalopathy can also be a cause of seizure. Do the liver function test, because hepatic encephalopathy is a cause of seizure. And along with those, if the patient is a known epileptic, then test for the blood level of the drug. Blood level of drug. So drugs, blood level, antiepileptic, blood level. Those are the things that you do inside of 5 minutes. And oftentimes the patient will recover without giving any specific drug. But if the patient still has seizure activity at 5 minutes, then you have to step in and you have to give drugs. And the common drugs we give are midazolam, 10 milligram, that can be given buccally or nasally. Diazepam, commonest medications, 10 milligram, can be given IV or can be given parectally. Lorazepam, usually given 4 milligram IV stat. And after giving those drugs, any one of them, we wait and we see if the drug takes an effect. But after 15 minutes, if the patient still has seizure, then we have to repeat the same drug once, only once. After repeating the drug, we try to correct any metabolic abnormalities such as hypoglycemia, if there is any. And after giving this second dose, we wait for another 30 minutes. And if the seizure continue even after 30 minutes of giving the second dose, then it's time to add a different kind of drug. And the common choices are phenytoin, valproate, and phenobarbital. The usual dose of phenytoin is 15 milligram per kg, 15 milligram per kg at a rate of 50 milligram per minute. For valproate or sodium valproate, the dose is 20 to 30 milligram per kg at a dose of 40 milligrams per minute. For phenobarb, give 10 milligram per kg body weight and the dose or rate is 100 milligram per minute. So we can use any one of those only once. And we monitor the patient after giving or starting the infusion, and we wait. We wait for another 30 minutes. And if the seizure still continue after 30 minutes of starting one of those anticonvulsants, now we have to shift the patient to ICU. Why? Because this patient will require a GA, general anesthesia, with IV anesthetic drugs such as thiopental or propofol. And obviously, whenever you are giving GA, you have to ventilate the patient. You have to give mechanical ventilation, and you monitor the patient with an EEG monitor if available. Hopefully, this will control the patient's seizure. Once the patient is stabilized, start the long-term treatment, and usual drugs are valproate and phenytoin. The usual dose of valproate is around 800 to 2000 milligram per day. And usual dose of phenytoin is 300 milligrams per day. And obviously, try to identify if there is an underlying cause of the status.